If that is up, the blood pressure is also down. And if all of those are down, the jugular vein pressure is also down. The PCW2 is down. But what is up is the skin. The skin is still warm, and that's because of the blood, all of the blood in the peripheral areas. Some of the blood may be pooling in peripheral areas, and some of the blood may be um, moving very slowly. And because of this, you could see that there's extra warm skin, especially. And let's take a look at his vital signs. His vital signs we'll be taking a look at 2 days, day 1 and day 2, where his temperature was 96.3 and 97.9. Nothing significant, nothing out of the ordinary. His pulse is 46 and 53. Now, this is where we see that there's a huge problem. That pulse rate is very low for a man of his age and his capabilities, unless there's something else. And this pulse rate is most likely due to the trauma, to his neurogenic shock. His respiratory rate is 12 and 20 on the second day, and his O2 is 100% and 98%. As long as we're maintaining airway patency, his airway shouldn't be too much of an issue. We could see that he's in ICU, he's on the ventilator, so he's being monitored and regulated most definitely pretty often. But what is also significant is his blood pressure is 115/57, and then when measured again, it's 113/57. For a man of his size, this blood pressure is a bit too low. For other people, this may be their normal, but this blood pressure is too low. Because of this, there's certain medications that were prescribed to him by the physician. They were atropine, 1 milligram. His heart rate is 46 and 53. There definitely needs to be some form of intervention for that. He is on dopamine. He's getting 5 milligrams per kg per minute. He's on Pantecta, 40 mg. He's on Clexine, 40 mg. He's on Mucomis, 3:1. He's on Midazolam, and he's on fentanyl. Even if it is not noted, this patient would most definitely be in some form of pain, especially after trauma that he has been in. Now, this is where our roles as nurses come into play. It's what we do as nurses that really make the difference. Now, it's good that we know all of this information about the patient, but what will we do in order to facilitate this patient getting better? So, let's take a look at our nursing management on the clinical map. Intensive monitoring of vital signs. This patient is in a state of neurogenic shock. In the ICU, the patient would be on continual monitoring. The patient is there's charting for his vital signs per hour. We already established that there's pooling of blood in extremities. We want to stop any embolisms or clots from forming. We want to lessen the patient's risk of anything else happening. So we want to apply anti-embolism stockings to this patient. We want to maintain circulation as best as we could. We would also want to do passive range of motion for this patient, if we could. If the patient is capable of moving by himself as much as he could, we also want to encourage independence. If he could lift a finger, tell him lift the finger, encourage him to lift the finger. Ensure to encourage him, make sure that he knows that he's doing good. Now, if he's unable to, what we want to do is we want to lift that arm up, we want to move that arm around, we want to lift the legs up, move the leg around. It helps with the circulation. It also helps to prevent contractures from happening to this patient. Now, the patient is on a ventilator. We may think that the patient doesn't need to be monitored too much for his breathing. He's breathing fine. No, that is not the case. What we want to do is we want to make sure that there's no kinks to his to the tubings. We want to make sure that there's patent airway, that the patient is breathing fine, clear. We want to listen to those breath sounds. We want to make sure that there's no adventitious breath sounds. We can see that the patient is on mucomist. We want to make sure that there's no wheezing. We also want to make sure that the patient is not using any axillary muscles. There's no grunting, gasping for air, coughing. We want to make sure that the patient is breathing easily, that there's equal rise and fall of chest, and just that the patient is not in any form of respiratory distress. What we also want to do as nurses, we want to reduce the patient's anxiety as best as we could. If there's sensory alterations in the patient, we would like to compensate for it as best as we could with our patient. Also, we want to perform therapeutic communication with our patient in order to reduce anxiety. We also want to communicate clearly with our family members that are visiting the patient, and keep communication with our family members and doctors clear. This is all for my portion of this presentation. I'll be passing it along to my colleague. Thank you.